Good evening. My name is Tenny John-Idiagbonya, and I am a student of Brandman University, um, presenting my proactive health communication portfolio for the DNPU 705 course. Today is March the 1st, 2020. For overview, we'll be talking about the purpose of this campaign, the communication portfolio. We're looking at the at-risk population, the goals for this target population, the health communication issues, which is for prevention, health theory application, multimedia approaches, resources, and how the proactive campaign will work. Information will be shared through communications and hurdles and on falls. The purpose of this um, process is to prevent fall and save the older adults. Now, fall prevention, falls results in loss of independence and a decline in the quality of life for this age group, according to Jane 2018. The World Health Organization also has a global report that indicates that fall is the second leading cause of unintentional deaths. It estimates about 686,000 falls that occurs yearly, and that these falls result in serious injuries or death. Education will be provided to community-based older adults on how to prevent falls, and they'll be encouraged to take simple steps towards preventing falls in their environment. They'll also receive encouragement on how to collaborate with their providers based on their unique fall risk factors, identified fall risk factors, to develop care plans that will promote safety, all centered around evidence-based practice. The at-risk population and county and subpopulation we'll be using the Baltimore City. That is where this campaign will be delivered. The Baltimore City population is about 620, it's over 600,000 people, with 47% males and 52.5% females. The population mostly consists of a majority of African Americans that are insured and uninsured, the residents are. The at-risk population also will be looking at older adults from the age of 65 and above. And in this particular area, the average life expectancy, according to the government records for Baltimore City, is about 70 years in this community. The goals will be to prevent falls by making clients aware of their fall risk and the benefits of preventing falls by having active conversations with their medical and mental health providers. This will support the Healthy People 2020 through injury prevention and promoting safety for all. Also, it will prevent falls that can lead to health complications and loss of independence. And we have a caption of Healthy Baltimore 2020 to support that. The health promotion issue, which is the fall prevention. The need for health promotion is due to fall incidents and fall-related injury health crisis among the community-based older adults. Most falls, according to Jackson 2016, occur in the community, and it can be attributed to a combination of modifiable and non-modifiable risk factors. But managing the modifiable risk factors with appropriate intervention can reduce the risk of falls. Now, these older adults, they live in the community, either they're living alone or with their spouses or with members of their families. They will be inspired to participate in simple lifestyle modifications that will be delivered through the fall prevention education to help them prevent falls in the community and in their homes. These older adults also, is worth noting that they do live in the community and not in any long-term care facility, and they are not hospitalized, and they really do want to maintain their independence, which is a strong incentive for them to want to prevent falls that could lead to hospitalization or institutionalization. The health theory that is applied for this education campaign is the Betty Newman systems theory model. This model basically uses the 6 categories of the nursing process to promote primary, secondary, and tertiary levels of health prevention. And it basically offers 4 prevention awareness that is provided to those clients that have never had a fall, those that are at a risk for a fall, and those that have a history for a fall, which basically covers the primary, secondary, and the tertiary levels of care. And the goal is to prevent either new first time falling or reoccurrence of falls. This approach is beneficial to everyone with or without a fall history, and it supports preventive care at all levels. The multimedia approach will be using brochures on fall prevention will be used to educate the audience on some of their fall risk factors, how to identify those factors, and simple lifestyle modifications like exercises that they can conduct in the comfort of their home to help strengthen their muscles, and other practices that they can indulge in to promote their safety. Community fairs will be held on fall preventions, and short videos also can be shown to help them understand and appreciate the need to prevent falls. Also, they will be offered pictures to show them the risk that could occur as a result of falls, resulting in their loss of independence from the fall-related injuries, and links and telephone numbers will be provided to this client as to how they can seek for help to further help them make them aware of fall prevention. For resources, the Center for Disease Control and Prevention, CDC, they have a lot of free resources available on their website, which will be provided to the clients. And also the local health department in Baltimore has a lot of materials which will be shared with the clients. Flyers will be handed to them and their families, and other resources will be shared from the community health centers and Center for Aging. These are examples of some resources that will be used from CDC, the Stop Elderly Accidents, Deaths, and Injuries Study Initiative. For every 20 minutes, an adult falls, brings awareness. 1 in 4 adults fall is reported yearly, daily brings more awareness, and also the fact that falls are preventable and measures that can be taken to help promote that. How this will work will be through the utilization of this fall prevention brochure that clients will be given a copy to share, take home and share with their friends on how fall can be prevented at home and in the community, and also the factors that predisposes them to fall, how they can better manage those factors so they do not have a fall. The goal is to prevent fall. And these are my references. Thank you for listening to my presentation.